Pharmacist role and responsibilities. A pharmacist is a healthcare professional who is responsible for dispensing and administering medication to patients. They play a critical role in ensuring that patients receive the correct medication at the right time and in the appropriate dosage. They also provide important information to patients about the proper use of their medication, including potential side effects and interactions with other drugs. Pharmacists typically work in retail or community pharmacies, hospitals, and other healthcare settings. In a retail pharmacy, they may be responsible for filling prescriptions, providing medication counseling to patients, and managing inventory. In a hospital setting, they may work closely with doctors and nurses to ensure that patients receive the right medication and dosage. They may also be involved in the development and implementation of medication protocols, and in the monitoring of medication therapy. To become a pharmacist, one must first complete a Doctor of Pharmacy (Pharm.D.) program, which typically takes 4 years to complete. These programs are offered by colleges and universities and include coursework in pharmacology, medicinal chemistry, pharmacy practice, and pharmacy law and ethics. In addition to completing a Pharm.D. program, pharmacists must also pass a licensure exam and meet any additional state-specific requirements. Pharmacists have a wide range of responsibilities, which can vary depending on the type of pharmacy or healthcare setting in which they work. They must be knowledgeable about the various medications available and understand the appropriate use of each one. They must also be able to explain the potential side effects and interactions of different drugs to patients. Additionally, they are responsible for ensuring that the medications they dispense are safe and effective, and they are often the first line of defense against medication errors. One of the most important responsibilities of a pharmacist is to provide medication counseling to patients. This involves educating patients about the proper use of their medications, including the correct dosage, when to take it, and how to store it. They also provide information about potential side effects and interactions with other drugs. This counseling is critical, as it helps to ensure that patients are taking their medications safely and effectively. Pharmacists also play a key role in monitoring medication therapy. This involves working with patients and healthcare providers to ensure that medications are working as intended and that patients are not experiencing any negative side effects. They also monitor medication therapy to ensure that patients are not taking any medications that could interact negatively. This is particularly important for patients who are taking multiple medications, as the interactions between these drugs can be complex. In recent years, there has been an increased focus on the role of pharmacists in the management of chronic diseases such as diabetes and heart disease. Pharmacists can provide important information to patients about their medications and monitor their progress. They can also help to identify potential complications and make adjustments to treatment plans as needed. In conclusion, pharmacists are an essential part of the healthcare system. They play a critical role in ensuring that patients receive the correct medication at the right time and in the appropriate dosage. They also provide important information to patients about the proper use of their medication, including potential side effects and interactions with other drugs. With the increasing focus on chronic disease management, pharmacists will continue to play an important role in helping patients to manage their health and improve their quality of life.